My name is Dr. Esther Nyambura Njoroge. I am the Vice President and Regional Director for Africa, and I'm based in Kenya, taking care of the whole of Africa. A nurse needs to know that first, she is a very crucial part of a team whose aim is to deliver free, safe, and quality surgery for cleft lip and palate patients, and their role is very important. Second, they need to know that their preparation of this patient for treatment will be key to the success of the treatment at the end of the day. And third, they need to know that after the patient has had their treatment, the advice and the care that they give to the patient after the treatment is very important and will also support the healing process of the patient. Surgery can be very daunting for many people, even me included. And when a nurse is with a patient before the treatment, their role in talking to the mothers, calming them, letting them know that the treatment will be okay and their child will be fine at the end of the day, that role is very important. And even counseling the mothers on how to care for the baby after the surgery has been done, and counseling the whole family, because we have children who have been stigmatized, they have been living in isolation, and this nurse, when they encounter this child, when they talk to them, when they reassure them and comfort them, they are able to go through the process of treatment in a more calm manner, in a more healing manner. In Africa, most nurses take care of the mothers in the family planning period, during the prenatal period, and they are possibly the first point of contact when the mother comes to the hospital, especially when the mother has delivered either in a health facility or even at home. Africa is a very large and diverse continent. We say we have one continent, but we have 52 of them in there. And it's very different from one country to the other. The kind of services and health providers that you find from one country is different from another. We range from one that has a lot of reconstructive surgeons to one that has nothing. And therefore, working in Africa, I'm working in a situation where we are either building something from nothing or we are working with what is already exists. And the Smile-Train model of empowering the local health providers is ensuring that we are building a system that will outlast Smile-Train, that will be able to provide care and treatment on a continuous basis. Every time a child is born, if they're channeled to the Smile-Train partner hospital, they're able to access treatment at the right time. Treatment in terms of surgery is a mainstay burden right now in Africa, because we are still having children who are growing up with their clefts, and we are finding them when they are already in their teens or in their adulthood. And we have a huge burden to address that surgical need. Beyond the surgical need, we are also looking at the comprehensive care of the patient, looking at the counseling in nutrition, as I alluded to earlier, the management post the surgery in terms of speech, orthodontics, and we are building systems that are health centers, Smile-Train partners that are able to care for the patient in a holistic manner, right from the surgery all the way to the time that the patient is living a normal, productive life. There are a lot of similarities. We are in both continents, we are dealing with a very poor population that is not able to afford the health care that they would need. We are dealing with a population that is, the information has not yet disseminated enough to eliminate the stigma and to enable the patients to be able to, when a mother has a baby with a cleft, they know it will be fixed, it's nothing big, it's not a curse, it's not something bad I did, I can access the treatment. That is similar both in Africa and in India. One of the differences, a major difference, is the number of trained professionals that are able to care for cleft lip and palate patients. In India, at every corner, you might find a reconstructive surgeon. In Africa, some countries you'll find 10, some countries you'll find none, and we are working towards training them and ensuring that they're able to provide the care. Africa is a huge continent, and inside each country, we have poor access to health facilities. The professionals will be found in the cities, and you'll find patients are traveling many, many kilometers in places that do not even have access to formal transport. So a patient will come and tell you, I had to walk for a whole day, for example, to get to the next point where I'm able to pick up what we call a matatu to get to a health facility. And they're traveling long distances to be able to get to the health facilities that are offering cleft lip and palate treatment. As the Vice President and Regional Director for Africa, I am responsible for the establishment, maintenance, and growth of Smile Train programs in all of Africa. We have partnered with about 212 hospitals, working with 228 surgeons to date and growing. We have so far treated over 82,000 children and some adults. And every year, we have been able to treat roughly 10,000 children, and we are growing. We started out 8 years ago when we had a couple of partnerships, and now we have, the program has grown in scale, in quality, and our focus is on safe, quality treatment. And therefore, we're not just picking every other person who comes to us, but we have a rigorous process of credentialing our partners and ensuring that they are offering safe, quality reconstructive treatment.